Thank you. My name is Abigail Aiken. I'm here to testify against HB 5510 on behalf of myself. Thanks for the opportunity. I believe the intent of the bill is to prevent or eliminate abortions in Texas, and I believe the motivations of the authors and supporters come from a place of genuine concern for unborn lives. However, I don't believe the architects of the bill have done their due diligence in three key ways. First, they have not developed a clear and accurate understanding of what abortion pills do and how the services Texas women are accessing actually work. I'm a trained clinician and a public policy researcher, and I've spent a decade researching the impacts of abortion policies here at home and worldwide. The majority of abortions this bill targets are actually provided by US licensed clinicians through telemedicine, which is now the standard of care for medication abortion in all US states where abortion is not banned, and in several other countries worldwide, including the United Kingdom and Australia. It is not unsafe for women. Indeed, we have an abundance of studies, some of which I have written, showing how safe and effective it is. Additionally, it doesn't appear that the authors have given more than a moment's thought to how the chilling effect created by this bill would affect access to misoprostol for miscarriage management and for postpartum hemorrhage. Second, the authors of the bill have failed to engage with the real people who have abortions to understand why they seek them. To pretend there's some kind of abortion industry forcing women to have abortions is disingenuous, and it provides a convenient workaround for actually engaging with the reasons why people choose to have abortions. If you're truly serious about wanting to prevent abortions, there are many things you can do, but none of them involve resorting to putting mothers like me at greater risk or encouraging citizens to engage in state-sanctioned surveillance of each other's private lives. Third, the authors have not thought through the impacts of this bill on women or on unborn lives in Texas. It will not stop abortions, it will make them less safe. Bills like this one are precisely the reason why unsafe abortion is the fifth leading cause of maternal mortality worldwide. The 20 million unsafe abortions since 68,000 maternal deaths that happened each year are concentrated in places in the world where people have no safe access to abortion pills.
Thank you for your testimony.
Thank you.
Members, there are questions. Ms. Donna, or I'm sorry.
That's fine.
Ms. Representative Howard.
Thank you, Chairman King. May I ask you if you could respond to some, because you've worked in this space with looking at the medications and the safety of them, if you can respond to some of the testimony that we've heard today about how it's unsafe and about how so many have indicated they've had clients present to them with bleeding, with pain, that they're being turned away from hospitals, et cetera. Can you respond to that?
Yes, I can, and I do think it's deeply unfortunate. Now, every medical procedure, including medication abortion, does have complications, and the issue here is that when people experience those complications, for example, we would expect about 1% of people having a medication abortion, whether it's at home or in a clinic, to come back presenting with some kind of complication. And if you are in a state where abortion is banned and you cannot go and tell a doctor what you have done, you end up in a situation where accessing the care that you need, if you are in that very unfortunate 1%, it's not possible for you because the chilling effect is such that you are scared. You can't be honest with your doctor. You can't go and tell them what you've done because you're afraid that someone is going to arrest you or with a bill like this, get your family in trouble. Now, I lived in Northern Ireland under a total abortion ban, and I practiced there, and I have seen this with my own eyes. So it does happen, but we're talking about 1% one out of every 100 women will experience that kind of complication, and the issue is when they cannot access care within the formal healthcare setting.
So the complications we're hearing about oftentimes are not addressed as they could be because of the way the laws are written that prevent people from seeking the care that they need. But then your final statement here is about the percentage of those that actually have complications is extremely low. You say how much?
It would be 1% experiencing a severe adverse outcome so 1 out of every 100 people using the pills. Thank you.
Okay.
Thank you.
Members, other questions of the witness? Seeing none, thank you for that testimony.